Assalamu alaikum everyone. I'm Professor Dr. Saba Tariq and I'm Dean of Pharmaceutical Sciences. I welcome you all on this Optometry seminar. Today is a very special day for me because I have been invited by none other than Professor Dr. Amir Ali Chaudhry, my teacher, my mentor, and the man who taught me that ophthalmology is not just about eyes, it's about seeing life clearly. I still remember Sir taught me in 4th year, and believe me, his classes were legendary. He could spot a sleepy student from 40 feet away, even without a slit lamp. I still remember one day he asked me confidently, "Saba, tell me what this patient has." And I, full of energy and zero idea, said, "Sir, conjunctivitis." He smiled, that famous calm, I know you don't know smile, and said, "Excellent enthusiasm, Saba." Wrong diagnosis, but at least it's from the same organ. So I learned two things that day. First of all, always examine before you answer. And second, never try to impress Dr. Amir Ali Chaudhry without checking the other eye first. Sir, your sense of humor, your elegance, and your patience made ophthalmology one of my favorite subjects. And today, standing here talking about eyes, I feel like I have come full circle. So today, I'll try my best to make this talk as clear and as focused as your vision for your student always was. So let's start this beautiful topic, the massive unmet need of presbyopia and how one tiny drop of VIZZ is changing the way we see the world. So this is our agenda for today. We will cover the unmet need and discovery in a snapshot, how it works. We will see the PK and formulation. We will see the Clarity Phase 3 clinical trial evidence. We will also look upon some dosing and safety pearls and the real-world impact VIZZ is causing. My goal is simple here, just to give you clear clinic-grade message so you can use that tomorrow. Just a quick overview of presbyopia. Presbyopia is the age-related loss of near focus as the lens stiffens. It affects approximately 128 million adults in the US and approximately 13 million people only in Pakistan. This is a huge amount. Local studies in adults of greater than 30 years shows very high prevalence. And over half of the middle-aged adults struggle with near tasks such as reading, texting, or threading a needle. We do have some traditional fixers such as readers, contact lenses, or surgery. And they do work, but many patients want an on-demand, reversible option that they can control. And that's where VIZZ comes in. So what's the magic? Actually, it's not the magic, it's the optics behind the VIZZ. This is how a presbyopic patient sees the world. So you can see here, the presbyopic patient is unable to focus on near vision and he cannot clearly see the near objects. In an exciting leap forward for ophthalmic therapeutic, VIZZ has become the first and only FDA-approved aceclidine-based eye drop for the treatment of presbyopia. It was approved in August 2025. This once-daily preservative-free ophthalmic solution offers adults the ability to regain clearer near vision for up to 8 hours without compromising their distance vision. This is developed by Lens Therapeutics and represents a major shift from traditional corrective lenses and surgical options, signaling the dawn of a pharmacological era in presbyopia management. So how VIZZ works? What is the pharmacodynamic behind VIZZ mechanism of action? Aceclidine is a muscarinic agonist, acting predominantly on the iris sphincters. It creates a small, controlled pinhole pupil which increases the depth of focus. That's why near vision sharpens often without compromising distance vision. Crucially, it's pupil selective with minimal ciliary muscle stimulation, lowering the risk of accommodative spasm and the classic broache. So here in this diagram, you can see the eye has both innervation, parasympathetic and sympathetic. The sympathetic innervation causes the pupil to dilate and the parasympathetic innervation causes the pupil to constrict. And here where the VIZZ comes in action. So VIZZ selectively inhibit M3 muscarinic receptors and causes the pupil to constrict. When it causes the pupil to constrict, it increases the depth of the focus of the vision. You can think about of this as a camera aperture. So when we have a dilated pupil, a patient can see something like this. But when the pupil constricts, it causes a pinhole effect which increases the depth of the field and patients can see clearly near objects. So how VIZZ comes into market? There was a phase 3 clinical trial which is known as the Clarity trial. So that is the trial that enables VIZZ to come into the market. So Clarity 1 and Clarity 2 evaluated the safety and efficacy of aceclidine in around 466 patients. And Clarity 3 clinical phase trial evaluated 217 participants for long-term safety over a 6-month duration of once daily dosing. So in Clarity phase 3 clinical trial, 2 6-week randomized double-masked control efficacy studies were done. Population was 45 to 75 years of age and they also included post-LASIK and pseudo-hypophages. So what they discovered? They discovered that VIZZ in 71% of the participants gained 3 lines or more of improvement at 30 minutes and 3 hours. And 40% maintained this at 10 hours. And over 30,000 treatment days, no serious adverse events were reported. The only common mild adverse effects that were noted were mild redness, temporary stinging, or reduced dim light vision. So how VIZZ is given? So VIZZ is given 1 drop in each eye and then you have to wait for 2 hours and then we can give a second drop in each eye. You have to remove contact lenses before dosing and you can reinsert those contact lenses after 10 minutes if patient is wearing contact lenses. If using other eye medication, you need to separate both dosing within an interval of at least 5 minutes. There's a practical tip that I would like you all to know. Advise first use at home to experience onset and dim light effects before driving at night. Most common adverse events are mild and transient. Some patients complain of conjunctival hyperemia, mild headache, or a sense of dimmer vision in low light. As with any miotic, be cautious in night drivers, high myopes, or those with retinal risk, and use your judgment on angle status and history. So what you need to tell patient is to expect clear near vision for the task they choose. They may notice slightly dimmer environments, so try it first at homes. And if a patient has history of iritis, use with cautions because it can lead to hypersensitivity reactions. So why it matters? Impact in clinic. Impact is tangible. Patient can read menus, they can check medicines, sign forms, use phones without reaching for readers. In practice, it improves convenience, self-efficacy, and for many, confidence at work. This also reduces spectacle friction for active professionals and post-surgery patients who still want occasional near boost. Why did we pursue a pupil-selective miotic? Because the gap was clear. People didn't want a permanent solution, they wanted a flexible, controllable one. Discovery work focused on maximizing near acuity while preserving distance and tolerability. That balance is the differentiator. That balance comes from the mechanism. So the miotic class is expanding, pilocarpine-based options and combination formulations are in development. Aceclidine pupil-selective profile aims to balance efficacy with comfort. And as post-marketing data grows, we will refine who benefits most. For instance, is it the post-LASIK presbyopes who are getting most benefited from VIZZ, or high screen time professionals, or those who still want readers only sometimes. And these are the high potential areas of research for you to look upon. So you can do research in these topics because the world has started doing research on these topics, and eventually in few months you will start noticing articles on these topics. So looking forward, you can expect better patient selection tools, real-world adherence insight, and evening lighting guidance. Presbyopia is massive, as we have already seen how much it's affecting the worldwide population, including approximately 13 million people in Pakistan. VIZZ uses optics, not accommodation. A pinhole effect for sharper near vision, and phase 3 data support efficacy with distance preservation for most.